Hi, everyone. This is Jim Haviland, and we are still working through our Smart 50 honorees for 2025. And this conversation about to share with you is with Patty Starr from the Health Action Council. Now, one of the things we'll talk about in this conversation is that health is so much more than healthcare, and that really employers have an outsized opportunity. I wouldn't say responsibility, but opportunity to impact the health of the people that are spending so much of their lives in their stead. So, very interesting conversation, especially right now as we talk a lot about health and healthcare. Please enjoy my conversation with Patty Starr from the Health Action Council. All right, welcome to Lay of the Land Weekly Impact. This is the 2025 Smart 50 edition, and we are here talking about the smart honorees and trying to figure out what makes them smart. So, Patty, thanks for making some time for us today.
Thank you for having me.
So, give me a little sense of the story arc. How did you get to this moment in time? Where'd you start, and what got you eventually to the Health Action Council?
Wow. Graduated with marketing and a minor in stats and management.
Okay.
Worked in publishing, then worked for a health insurance carrier. Owned my own business as a small business and individual broker consultant.
Okay.
Then went over to Cozy and helped run their small group healthcare program. And then from there,
I and many of
over
my colleagues have been taking advantage of that. Yeah.
and then moved over to Health Action Council, where now I'm helping large employers with their healthcare benefits.
Well, that's fantastic. So, how long have you been with the Health Action Council? Is your creation?
No, Health Action Council actually was created back in 1983
Okay.
by about 5 trailblazer organizations in Northeast Ohio who really were trying to improve healthcare for their employees.
And when I was reading about your organization, it's the notion of what we know about what makes for healthy employees has changed so much over the years.
Mhm.
We spend it isn't just about, hey, are they paid well enough? It's like, are they engaged? Are we creating a psychologically safe space? So on and so forth. I mean, I spend a lot of time with my clients helping them figure that stuff out. Looking with you know, reading tea leaves of how people behave to see whether it's they're doing a good job of that.
That's great.
How much? What has changed for you? What makes this so special?
I'm really passionate about health,
Okay,
not healthcare by
right.
itself. There's a difference between healthcare and health. I'm really passionate about the health of an individual and them to be able to live their fullest life that they want.
I've had
Friends
I've
and
had someone tell me
families and
that it's
work.
not really health care. We have health repair. And we call that healthcare, but it's actually, creating a healthy environment and helping people really be healthy is a different thing.
Absolutely. And employers have a very important role in that because employees spend a lot of time working. That's a good part of their day, at least 4 or 5 days a week.
Right.
So employers play that role in being able to provide benefits, which obviously help them both financially and from an accessibility standpoint. Also, just making sure environments are safe. Education's phenomenal when it comes from an employer sharing what are some best practices, maybe even setting up some programs where they can engage. Because once you engage someone for that 28 days, we know that they're more likely to make it a habit. So really, the employer has a great breadth of impact on an employee's health.
Well, and it's enlightened self-interest, right? I mean, that engaged employees, healthy employees are all better at being able to achieve the aims of the organization.
Correct.
So what excites you about the work you're doing right now, and what's changing about
So it's constantly evolving. We've been
that?
talking about this a lot recently that what's good one day not necessarily is good the following day and or needs to already be advanced the following day. One of the projects we're most excited about is our work that we've been doing around social determinants of health within our population. We recognize that once somebody gets sick, to your point, they can go into the healthcare system. They get managed either through a navigator, through utilization management, case management,
Mm.
because they're chronic, they're complex. They get the support in most cases that they need. However, how do we help control the overall cost? Once we allow someone to get down to where they have a medical condition and they have that complexity, we have efficiencies and effectiveness and navigation that can help us control that journey and help them and support them. But how else can we control costs? And the best way to control costs is actually to eliminate it, right?
Hmm.
So we started to look at employees and their dependents and saying, what else is driving some of these costs in healthcare? And we really found that about 80% of it sits outside of the healthcare system and not inside the healthcare system.
Okay.
It's driven more by what we call today SDOH, or social determinants of health issues, which could be transportation, it could be food insecurity, housing insecurity, isolation,
Mm.
education, literacy. So, a large breadth of other things that can impact an individual's health. And what we ended up doing is taking someone's clinical risk and then overlaid their social determinant risk on top of it and said, how can we better support these individuals?
Right.
And we created a system that's accessible either through the customer service unit or through the clinical unit. And additional outreach is done to those individuals to get them the services that they need to actually help eliminate some of the healthcare costs.
Well,
And coming 1/1/26, we expect that we're going to be able to transition that system so it's just not outreach to those employees, but also those employees will now be able to reach into the system as well and say, hey, I need help.
got it. Yeah, it reminds me so much of when we work with leadership teams. We're talking about we have a model for the hierarchy of needs, right? And how
Hmm.
when you're sitting here, working with me on your strategy, I want you not at the bottom rung or here. I want you to get as far up as I can. So I put food out and beverages out. But it's like same thing for everyone that's working for you. If they're in the physiological stage, uh, they're not going to be able to focus on work.
Correct.
Yeah.
Absolutely.
Well, great. So tell me a little bit what leadership lessons you take. So you're here because you're actually doing great work, and you must have some leadership capabilities. What do you look to as far as your leadership advice and things you've taken on over the years?
I would tell you one of the biggest things I've learned is listen, listen more than speak. The people around you, no matter what level they are, they have something to bring to the table and you can learn from them. So you can compile then those learnings and really help even grow your teams more and build more collaboration across them because you've listened to all of their voices and you've brought them together for one reason, to really grow together.
The in my portfolio, my years, the leaders that are the most listening, the most realizing that they couldn't possibly know it. There's nothing about leadership
Yeah,
is organic,
right.
right? You gotta learn that journey, right?
Mhm.
So, have you had along this path? Have you had some mentors that helped you, you know, do what you're doing today?
One or two, and they've taught me some really good lessons
All right.
and shared some of their expertise. That one is always ask questions.
Uh,
Be open to the answers too. Just don't ask questions, but learn from the questions you're
got it.
actually
Yeah.
asking, which I think is really important. And then the second is it's not just about the short term, it's really about the long-term journey. So yes,
Right.
you have to dance for today and be agile and flexible for today, but you should always be looking
It's got
forward.
to fit into a larger
It has
framework.
to fit into something much
We
larger
like
than
to
you.
call that ad hocery when you just focus on today. We're like
Right.
going to solve the problem today, but how is it? It's going to keep coming back if we don't
Exactly.
take a long term view of it. And do you want to name check anyone that you want to give particular attention to?
Not at this time.
Okay, no
Thank
problem.
you though.
So tell me about the team. So how large is the organization?
Today we sit 15 strong and mighty.
All right, very good. And quite often we talk about culture being an important
Mhm.
part of keeping an organization really running well. And what kind of things do you do to keep the culture in
I'm
line?
very much committed to culture.
Sure.
We have a value statement, multiple value statements that we have. We also have a ways of being of just that as we onboard people, we share with them some of our expectations around how we treat each other, how we interact with each other, how we just work on a day to day basis. And then we also do team meetings. I invest into our team at least twice a year, and I bring everyone together,
Mm.
and we really do sort of that brain dump for about 3 days, and we learn from each other,
Oh,
and we
interesting.
build collaboration across the team so that as we leave the room, we know who our partners are, what we're working on, how we're gonna work for the next X amount of months or years.
Right. That's brilliant. Yeah.
Yeah,
We definitely suggest having a consistent cadence, a consistent mechanism for all that kind of stuff. So it becomes part of the what we call rituals, artifacts, and language of the organization. Hence
absolutely.
the culture. Very good. Anyone you want to thank for the honoree being an honoree with Smart 50?
I would definitely like to thank our team at Health Action Council. They're wonderful to work with. They've really been supportive. Our Health Action Council, also our member leadership, and then just friends and family for their ongoing support. So
Brilliant. Thanks
thank
so
you.
much.
Thank
Appreciate
you.
it.